I'll get it right here in a second. Today is March 23rd, 1962. What the hell? It's March 23rd. I got my second COVID shot today, so I'm a little. Where am I at? Anyway, today's March 23rd, 2021. And I'm going to give you some quick numbers. Tonight we're going to be talking about erectile dysfunction. It's going to be myself, Santiago, and Wayne. And we're going to be taking questions from the audience. And if you have any questions, please make sure you send them in. Quick reminder, even though the mask mandate has been lifted, wear a mask. If you come to visit us here in person, you will be asked to wear a mask. Some cases it might be smart to double up. Our numbers real quick. These are for San Antonio, Bexar County area only. 133 new cases, 2 deaths. I believe are on the little line where they have good, moderate, severe. I believe we're down at the safe end of the spectrum. So keep that up. And like I said, I got my second vaccine shot today. If you haven't got one, see about scheduling yourself for one. Really, you only need to be HIV positive to have an underlying need to go ahead and get one now. But all the people should by May 1st be able to get a shot. Santi, Wayne, y'all want to come up here and join me? And let's talk about that little fellow who just likes to plop over every now and then. Erectile dysfunction is actually, if you're taking HIV meds or if you're diabetic, it's quite a common instance. So we're waiting for you. Stop eating the birthday cake. I know they probably aren't expecting me to say this, but I want to say thank you to the guys here. They brought me a birthday cake. My birthday is this coming Friday.
So yeah, so they told me to.
Don't you?
No.
No, I already know what you're going to do. Get away from me with that cake.
Oh, shit!
Happy birthday, bro. Happy birthday.
Oh my God. Well, thank you. No, you can't have the chocolate cake. Give me that.
You told Leo about that. He's the one that told me.
Leo. Well, I should have known. I can't see my face, so I hope it's all gone. Somebody, I need makeup, please.
Paper bag.
So the topic is about ED.
Yeah, take it over while I clean stuff.
You know, it's almost like, somebody just give him a cream pie. But what happens if you can't get it up because you have erectile dysfunction?
And what causes erectile dysfunction?
Lots and lots of psych meds.
Yeah. Actually, that's true. A lot of your meds, especially if you're diabetic and you're not controlling your sugar, that is actually going to affect ED.
Well, actually, even some of the medications you take causes ED.
Right. Especially when you're HIV positive, those meds can, I'm not saying will, but may cause ED.
And particularly, so in my case, what issues I had with, and I switch around a lot, I take, I take 9 psychiatric pills a day. I switch off Abilify. Abilify has a lot of side effects of ED. I'm trying to think which other ones too. One of the sleep aids that I was on, which would have been Quanapin, also affects you. And I'm always complaining about it, and sometimes now I'm telling me I need to get an EKG done to switch to another medication, and poor Jase, you have to clean that shit out of your glass.
I'm sorry, I'm still cleaning glass.
I'm so sorry. Again.
No, you're not. You enjoyed that.
I was told to do that.
Oh, you enjoyed that.
So one of the questions is, can you take Viagra if you have HIV? So Viagra is generally safe to take with ARVs. However, problems can occur for patients taking certain HIV medications. So if you're trying to buy that little blue pill, I would for sure ask your doctor if it's okay to mix it together. Because if not,
High blood pressure medication also.
yeah, I mean,
Yeah.
just the same,
Yeah.
you know.
Matter of fact, you have to be very careful if you're taking a blood pressure medication because basically what the blue pill does, it raises your blood pressure, which causes blood flow to go down to that little member who doesn't want to stand up.
So you're saying you have a little member then?
Well, no, not in my case.
Okay, let me ask you a question, Jase. Do you have that problem?
Yeah, actually, I do. I do. I mean, I've never used
Viagra?
Viagra or any Cialis or anything like that. Because there are times when I feel like I'm horny as hell, and I feel like I'm standing up straight, and then I look down there and it's got like plop, you know, and it's like, what the hell?
How often does that happen, occur to you?
Actually, it's become more common. It used to happen every 2 or 3 months, but now it's probably once, sometimes twice a month now. Part of it may be age, but I think a lot of it more has to do with the amount of medications I take. Obviously I take Biktarvy for my HIV, but I also take 4 or 5 medications for my diabetes. So I think it all just winds up building up. And while I haven't tried the little blue pill yet, I've thought about giving it a try. But again, I also have high blood pressure, so I have to be careful about what I use.
How about you, Santiago? Do you have that problem?
I'm not saying I do, but what I'm saying is when you start getting heavier, you start gaining weight, you end up starting gaining it. And again, because of your diabetes, that can happen too. But once you start, I don't say curing your diabetes, once you start regulating it, that it starts coming back. So it's not that you actually have it, it's just because, like I said earlier,
once
because
your
your
diabetes,
medication, because your diabetes.
If you have it under
your
control,
weight,
it's less likely.
And also stress and depression. Those 2 things also add into it that you end up getting it.
I know this person, of course I'm not going to say a name. I know this person is extremely fit, has the six-pack and everything, and he just went through that issue that he has. He's not diabetic, but he is HIV positive. And his doctors say it's because his HIV meds is effective.
Do we know which meds?
And we're talking about a young guy. I cannot tell what HIV meds he takes, but we're talking. I think he's 26.
Wow.
That is really young.
Okay.
And how often does it?
I would think it would be more supplements for weightlifting.
Yeah.
So
In other words, steroids.
Doesn't take no.
Steroids.
Yeah.
Well, I didn't mean steroids. I'm talking about just any type of supplements.
Not really. I mean, I used to work at GNC, so I used to get a lot of older men, even younger guys, that would want to go buy. Remember back in the 90s, everybody was trying to buy horny goat weed because they were supposed to make you rock hard all the time. Does anybody remember that?
No.
The homie? Yeah, stuff like that. People would go to GNC and buy, a $20, $30 bottle of probably like a 30-day supply of horny goat weed because that would get you so hard, allegedly. It's a myth. I mean, it's just another herb like any other herb that you buy for whatever reason. For memory loss, you're supposed to buy ginkgo biloba to help you remember. You still have chocolate right here.
Was John? I didn't have my glasses on. Were you the one that had your hand raised?
Yeah, but I didn't hear the entire conversation.
Okay.
So I was just, all I heard basically was diabetes and HIV meds. I didn't hear anything else.
Well, that was how that those can both be effect.
I have lots of friends who acquired diabetes because of the early meds.
Oh, because
yeah.
of ACT? I mean, not ACT.
Yes. All the early drugs which I was on.
Okay.
Not everybody would develop diabetes. It was like a small percentage of people. I do have the blue pill, actually the generic blue pill, just in case.
Okay.
I don't use them, just in case.
Because
That's fine.
Viagra is one and Cialis. What is the difference between? Do any of y'all know what is the difference between Cialis and Viagra?
It's pretty much the same thing, from my understanding.
But one you take every single day, right?
Yeah, well,
But
yeah.
you only take it when you 30 minutes
30 minutes prior
to an
sex
hour
activity.
prior.
I know the Viagra you take
It's just-
30 minutes before you do the deeds, but I thought the other one you took every single day. Because,
Let's find out.
yeah,
Yeah, see what they are.
when I saw Dr. Martinez, when he put me on my medication for my diabetic, take a couple of pills and the shot of course, he asked me if I wanted Viagra or what have you, just in case. And I said no. So it really has not affected me that much, but it's been there every once in a while. But not to the point that it happens once a month or once a week. It's rare that it happens.
So here it's saying that Viagra is not used daily. It says it's prescribed to be used with
Not Viagra, the other one.
Cialis.
Cialis?
Okay.
I think that one you can take like just basically when you want to have sex. I don't
Yeah,
think-
as far as I know, that's what I know, is right before sex. 30 minutes to an hour prior. And also, I think that it comes in milligrams too. Yes.
So how can you differentiate, well, what's the difference between erectile dysfunction and just getting bored of sex and like doing the middle of sex?
I think if you get bored from sex, I think it's totally different. Because if you meet someone, you hook up with someone, you're hot rock, you do the deed, and if he's just a lazy fuck, just lays there, doesn't do anything, that would bore the shit out of me.
And then that would just turn you off.
Yeah.
it would just turn
And
me
that's
off.
happened. Where, you know, you've been with somebody and the chemistry's not there and you just don't get hard because there's something there that you just did not like and you just can't go. But if you're attracted to that person and you can't get hard, then I would assume that is ED right there.
Yeah.
You know, but there's different forms or different things to help you out. I mean, there's that pump. You know, we all laugh about it, especially what was the movie Austin Powers when they take out that big ass pump.
Yeah.
And he was like, "Oh, that's not mine." Well, you know, here's a receipt and everything. And, you know, you're the member, blah blah blah. You're the, you put it on your dick, you pump it and everything. You know, that's supposed to help you last longer. And I think there's a
Supposed to
band.
make you bigger, and thing is, I tried one time just to find out it does not get you hard.
Cialis take
Well, no, you,
Right?
Go ahead. Daily, from 2.5 milligrams to 5 milligrams.
really.
Yeah, that's why I thought, yeah. Because someone told me that that's why they were doing, taking that medication. It was.
But they're looking. If you've already got if you've got a pulmonary arterial hip hypertension diagnosis, that's why they're using the Cialis. A little bit different than what it does what Viagra does, but there's a little bit different medical issue than what just.
So if you basically,
Erectile
if you're having
dysfunction.
problems with hypertension, high blood pressure, Cialis
Yeah.
would be the one to use.
Okay.
There's also,
Okay.
there's also cough rings that you could use, right?
Oh yeah, I mean, but also you can use a cock ring to get you hard and keep you hard. The other thing, your dick will get used to it. That now you may not be able to stay hard all the time because you have that ring all the time. That it just depends on it. So either you end up going a smaller cock ring, or you end up finding other ways. You know, we all see the porn where this guy has probably like 3 cock rings or something like that. You know, that's just way too many. I mean, if you're wearing one, that's fine. I mean, like
I've never seen one with somebody wearing 3.
you never seen.
No, this sounds interesting. I might
No,
be
no, no.
interested.
I've seen the double cock ring where it goes around your cock, but also around your balls. It almost looks like
yeah, I've seen those.
I've
Yeah.
seen it. Yeah, the 3.
Three.
The 3 prong.
Okay, John.
Yeah, John.
I had one, it was like that big or so, it was metal, chrome, it was kind of wide, and there was one time I couldn't get it off. It was killing me. It would not, I couldn't,
Did you have it around the shaft, or did you have it around the whole thing?
whole thing.
So,
They have a special tool at the ER for that. I've known 2 people that have
It took
cut
several
off.
hours to rinse it.
Well, I had a friend who went through that situation. He used actually cooking oil.
Yeah, I've heard that too. You use
Yeah.
baby oil and cooking
Cooking
oil.
oil on it.
Yeah.
And it just lit up.
You need something greasy.
And then I had it in the bathroom, my mother saw it and asked me what it was, and it said it's a cock ring wash. Okay.
It's a napkin holder.
So I guess I'm
Big,
gonna
heavy
Okay,
napkin holder.
Did you say it was a metal one?
Yes.
Oh, that was, I hate those.
all right.
It was like that wide. It was like a chrome one, it was about that wide all the way around.
So
10 millimeter.
I can't believe I'm gonna say this only because the client I had when I was at the gym, I was training him. I was wearing some shorts and everything, and we were working out. And I was sitting down. All of a sudden, I stand up, and something falls out and it just starts bouncing.
Clink, clink, clink.
Clink, 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 clink. And the client I was training at the gym goes, "What was that?" I'm like, "Nothing." And yeah, so I know what you're talking about because sometimes that cock ring, if you don't put it on right, or you just get really relaxed, or your balls just decide to go back inside, that thing will just fall. And especially he was talking that metal one. Yo, and this guy does not stop reminding me about this. Yo, remember when we were at the gym and your cock ring fell off? Like, you fucking asshole. But it has happened. But again, going back to, you can't be wearing the cock ring all the time because you will end up losing sensation.
Okay, what was the reason you had it on then?
I think I just had it on because I liked it. I think I just had it on because I had it on. I was either.
Have sex after the gym.
Maybe.
Anyways, maybe.
Well, no, there are people who do wear them just because they like the way they feel.
No. And I'm not the first one to do that. I was talking to a dude at the gym one time. He was gay. I knew he was gay. And we were talking bullshitting. And he told me that him and his husband went to go look for a car. They were at the car dealership, and he was wearing some shorts. And boom, his fell off too, went right underneath the car. And we were just cracking about it. But, we're going back to things to help you out. We said the pump. The pump is one. There's another other than Viagra, Cialis.
I mean, you could get surgery for also.
Matter of fact,
Right, but what happens when you get surgery, you end up having to lose one of your testicles. So one of the testicles, yes, look it up. One of the testicles, you end up putting a ball and pushing it.
I actually know someone who just got it done, and he did not lose a ball.
Are you sure?
Yeah, there's a new. I just saw it the other day. There's a new one where they go in and it's done just like the way they do a blood clot in your artery in your leg. They just go in there with a little thing.
you're talking about the pump?
Yeah, so from my understanding, from what I've heard before, that they will take out one of your testicles and put in a plastic ball, and you end up squeezing the ball to lift up your dick or to make it hard. And once you're done, then you just kind of like inflate it. You just push it, and it comes down. There's that, and there's another one when you're hard, right between. I still have chocolate.
I do too. What the hell?
To get hard, you end up pulling your skin, and you get a little needle, almost like your diabetic needles, and you insert a small little needle, and I don't know how much of the liquid or it's not insulin, but it's a little liquid that you put in there to keep you hard. I'm trying to remember what it's called.
I heard a conversation about that someone, you take a shot for you to stay hard, and I also don't remember the name of it, but
That's what the porn industry uses also.
The what?
The porn industry uses the shot also.
But you see, with a pump, I mean, I think it will be weird because if you have to pump your left or right ball, it doesn't matter which size it is, I guess. And you want to get soft, you pump it again, or you do what have you. What happens if you're going at it and the other person squeezes the ball? Your left ball, and it goes down. I mean,
But I think that's where you would get more like, yo, don't talk about that. Because remember, there's guys that don't like to have their dick touched. It's like, all they want to do is fuck you. Or all they want to do is get fucked. Like, have you ever had sex with somebody and then you try to do a reach around, and they're like, no, they push your hand away
Yeah.
because they just don't like being touched.
They're getting the pleasure from
Just from you.
From
So
being
I would
true.
assume the same way
No.
that if especially when it's I think it's gonna be a mind over matter thing, because if you got that done, that you got the pump, and you're having sex and they're trying to grab you, play with your balls and everything, you're gonna pull away and you're gonna get pissed off because
But-
you know intentionally.
well, you know, if
But if you're into it, and you could actually just forget about it. Your mind is somewhere else because you're being pleasure in the sense that you probably never had before, and by accident it speeds that ball and goes down. And if you don't want them to know, because I would assume personally, if that was me, I would not want to tell someone I have a pump on. It's just, I think it will be embarrassed.
well, you know, the thing with the pump thing is, generally people who have that have had maybe they had testicular cancer and they had to have one of their testicles removed, and they have a medical reason for not being able to get erect. They've had a disease or something that causes them to permanently have that dysfunction. So in order to get it up, they get the pump.
I think it's called. I think it's called Trimex injections. TRIMIX.
Okay. But like you're saying, I understand what you're trying to say about the pump. But if you didn't get the pump, it's because you just cannot get hard, no matter what.
Yeah, that is the reason they're getting it, is because they can't get hard.
Right.
Yeah.
But
You're gonna get it 'cause if you still get hard, you're not gonna get the pump. There's
No.
a reason for it. It's gonna probably screw you over.
But the thing is, what I'm saying is, like, let's say Santiago and I, we can get hard with a pill, or we can get hard naturally from time to time. If somebody's getting the pump, this means they're not being able to get hard at all.
Right.
And it usually has to do with, 9 times out of 10, it has to do with testicular cancer, I believe. Maybe that may be a slight exaggeration, but the
Yes.
majority of the time.
Santiago mentioned something about mental, whatever, like mentally, what's going on mentally when
Yeah.
you're having sex.
Right.
Do you think that also has an effect on people with ED as well? That like it's a mental, something going on in their mind that just maybe they're focusing so much on one thing that all the blood goes to their brain or something.
You know, I do agree with that. I think you're right. It's mental, because if you're thinking about it, like, I'm gonna fuck the fuck out of this dude, blah blah blah. But then you're thinking other shit is coming in. It's like, yo, what if, especially knowing that you have HIV, what if the rubber breaks? What if this happens? Now you're stressing yourself out.
I
On the
think
situation.
I believe the mental part is a smaller percentage of it.
You think?
Oh yeah.
Oh wait, 1 second.
If you cannot get hard, it's not because you're thinking about, oh, what happens if the condom breaks? That's not the reason you cannot get hard. If you cannot get hard, there's something wrong with your body that's not making you get hard. The mental part, I understand, because I've been in a situation before, not about a condom or anything, that I was so excited to be with this person that I couldn't get hard. Because I was so super excited, I wanted to be with this guy, and it just would not happen. Because mentally, in my head, I was overthinking of everything what was going to happen. And
But-
it just did not happen.
Wouldn't there be more of a pre-ejaculation where you just end up coming way too early?
No, I did not even.
Well, you know what? Actually, since you said that, I think sometimes it's erectile dysfunction, sometimes it's early ejaculation when you're starting to have issues like that. And
Was
it's,
a lesbian, please?
Yes. I think there's also an issue, and it hasn't been discussed or hasn't been, I don't know if it's been considered, but there's an issue of drugs and alcohol, which
Oh, most definitely.
Yes.
And we need to discuss that also, because that's pretty rampant in the LGBT community to begin with. I mean, not that ED doesn't affect everyone, but I'm saying in particular, since we're talking about, living positive, and a lot of people in our group, not everybody, but a lot of people in our group tend to be LGBT. We have to discuss that, or at least consider it as part of the issue for ED, because we don't, the drugs themselves, and the depression they bring on. Depression can make you not want to do a lot of things. It
Exactly.
also shuts your body down to wanting to get up in the mornings, wanting to do a lot of things. So, we need to explore those as factors.
Yeah, 'cause-
you mentioned
Because during my
drugs.
addiction, like for the first 5 or 6 years, it didn't affect me. But after that, after long-term use, it had started to cause, I don't want to say damage, but it started causing, erectile functions. Sorry guys, my COVID is kicking me today. I cannot talk. That long-term use does affect that.
Okay.
Well, no,
that is the drug part, not the alcohol part, the drinking part.
You get whiskey dick.
Huh?
It's called whiskey dick.
Okay. It to me.
okay, now why go ahead.
Go on.
I was gonna say, why is it called that? I mean, how does the whiskey affect that? I mean, does it affect like that part of your brain,
It's
or?
not just the whiskey itself.
I mean, whatever alcohol.
I'm switching to bourbon.
But I mean, obviously it happens with other alcohols like vodka.
No, because I mean, look, I'll be the first one to tell you, and I know we have another question over here, but I'll be the first one to tell you, like, where I've been so drunk where I can't even get hard, because I just drank way too much, and they're just like trying to blow me, and look, and they knew that I was drinking a lot. I knew I was drinking a lot, so yeah, that was whiskey dick, because it doesn't matter how fucking sexy this person was, man or woman, I was just so drunk. But then there's the other people that still are drunk as fuck and they still rock hard. So, I'm sorry, John, were you going to say something?
Yeah, there's something else that it can cause erectile dysfunction. When you're having sex, it's when you're like really hard, you're getting fucked really hard.
Okay.
It's like you're so tense, and you're so like, oh my god. It's like you're tensed up, and you can't.
Okay, let me ask you a question. The guy who's doing the fucking, and that's who you're talking about, that get hard. Okay, if this is the way I see it. If I'm going to be fucking someone extremely hard.
No, it's the person who is getting fucked.
Okay, is the person who's getting, okay, this is the top speaking. If I'm fucking a bottom, I don't care if it gets hard or not. I don't care. I'm the top. I'll work on myself.
Shouldn't your partner be as aroused and pleasure as well?
A bottom doesn't have to be hard to get pleasure.
Okay, now Mark, I'm a
But
top, and
I
to me,
understand
it's
what
kind of
you're
a turn
saying.
on to know that. For me, it's kind of a turn on to know that the person I'm fucking is getting hard.
Exactly. For me, it is also. If I'm fucking somebody and I'm in there and they're just going like this, and then I also hear no kind of excitement in their voice, now I'm going to start going limp. I want to be at that point.
That's not what I'm saying. I'm saying some bottoms, not every bottom, some bottoms don't get hard when they're getting fucked, but they're getting pleasure out of it.
Right, they do.
You see, and it's just, to me, being a top, honestly, I don't care if you get hard or not. Because I don't give a shit about the business.
It's all about you.
Yes.
Which is fine. There's nothing wrong with that.
But I've been with bottoms who don't get hard, and I've even asked the question. I mean,
It just means you're a terrible top.
trust me.
Trust them.
See, you've been that hot.
I repeated what you just said.
Shut up. And so, but I'm just saying, it's just, a bottom doesn't have to be hard to get pleasure. Sure or not? Are you talking, because you're talking about bottom, Leo?
I'm versatile.
Okay, when you get fucked, Leo, okay, you can be totally different from another bottom, but when you get fucked, are you always hard? Okay, you're not hard.
Okay,
You get
why?
pleasure out of it. By getting fucked. That's what I'm trying to say.
But why are you not hard when you're getting fucked? Is it because you're not enjoying it, or
My mind's thinking about other things like
School.
school,
bills.
work?
where's this smell coming from?
Before my next oil change on my car.
What am I gonna wear for work tomorrow? Back when I was working.
Is it, okay, you're thinking that because he's lazy fuck or bad fuck?
No, that's just what's always going through my mind.
Really?
Yeah. I always worry about.
Other stuff.
I
Okay,
mean,
do you
I've
get-
done that too, where I'm having sex with somebody, and then I'm thinking, shit. Especially if I haven't gone home all day, it's like, fuck. Have the dogs been out? Fuck, man. If I get home, that house better not be a mess. You know, you're thinking about that. So instead of concentrating on that ass you're pleasuring at the moment, you're thinking about the dogs, you're thinking about the dishes, you're thinking about what bills need to be paid and shit like that. So that does throw you off. So it's not just, I wouldn't call that part of ED, but again, overthinking a lot of other stuff.
I think that's sometimes is the mental part of ED, because it takes your mind away from what you're being pleasured for or what you're pleasuring yourself for, and then suddenly you're not hard anymore.
So this is from 2019, so it's a couple years old. Erectile dysfunction often affects men that get older. It is also more common in men with HIV than in general population. Although it has been difficult to estimate how many men with HIV are affected, researchers suggest that around 40 to 60% of men with HIV may have some degree of ED.
I have a question. Does this say anything as to why is it HIV itself? Is it medications they have to take?
It doesn't say. I mean, I would have to read more into it.
Because I that's another thing we have to take into account is the ED being caused by the medication we're taking, or is it the HIV itself? Because HIV is not just in your blood. It gets inside your organs. It gets inside your liver, your heart, your brain. It lives within the tissues of your body. So that would be interesting to find out, because I'd like to know.
And the age thing is definitely one of the big ones, like he's saying, because, like I said, when I looked at it, it talks about the breakdown of I watched it on Dr. Oz.
So
how did they do, how it would break down and how they go back in with that little laser now and open back up some of the blood flow.
I've had this conversation before with other people I've talked to. I'm not saying they're friends, it's just acquaintances. Especially this guy who we're talking, and you can go back 6 years from now that this conversation was, but I think it still relates to this. He was a top who could not get hard. He flipped to be a bottom because he was embarrassed because he couldn't get hard. It's easier for a bottom not to get hard and just get fun and pleasure at the top. So
and yet
you make that switch.
And like I said, I mean, I like to see the bottom get hard. But the fact is, sometimes for the bottom, their pleasure is from getting fucked, from being a bottom. So getting hard may not be essential for them. And yeah, I know people like that too. That
What?
I mean, I know other bottoms like that too. It's important to know that these male-specific symptoms can also be signs of other conditions. If you have any one of these, make sure to speak with your doctor. Low sex drive. This is a sign of help me say this word.
That's why I gave it to you, because I didn't pronounce it.
Hypogonadism? Come on, you should know this word. Hypogonadism. Which means your testicles don't make enough of the sex hormone testosterone. This condition is tied to HIV. So having HIV can lead to the low
sex drive.
Yeah, low sex drive and low production of testosterone.
So my question, actually I got two questions. So my question is it because you're psyching yourself out, I'm HIV, blah, 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 or is it because of other reasons? That's question number two. Number two is there anybody else that is suffering from ED? And if so, hey, put the question out there. I'm sorry, I can't answer them. Wayne's trying to answer all the questions. That's why he's all busy over there.
And if you're embarrassed to ask a question or answer the question, you can send them a message, a private message to Wayne. Don't send it to me because they're using my phone. I cannot get it. You send it to Jase or Leo or Santiago, and we will not say your name out loud at all. But if you have a question about it or a story, let us know.
I want to mention that it mentioned that the low testosterone was one of the reasons for having ED.
And fatty, I was reading that in combination with fatty.
Well, a lot of doctors will actually prescribe, and I actually have a friend who actually uses the testosterone gel to give himself a hard-on. Because
I can see that.
I've heard that before.
So, and I have heard that too. So I guess that's another form of if you can't take Viagra or Cialis, I guess you take the
But
testosterone
there's
gel.
pills for that too, right?
I don't know if they're testosterone pills, but I know there is a gel.
There's testosterone that you could take.
Or is it a shot?
It's a shot. Actually,
Well,
there's
no,
no pills,
actually,
but the
actually-
best one.
Because there is a gel. Because I've actually taken it.
Is the testosterone boosters.
Boosters?
Is in, it's almost like, if you're taking
Yeah.
insulin, same thing.
Same
Especially a lot of bodybuilders use it because they're using so much testosterone.
Okay, let me
Because,
ask you a question, Santiago. You used to work out before a lot.
Right.
Now you don't work out because you injure yourself.
correct.
When you used to work out, did you have problems getting hard?
No. I was also, look, I'm horny 24/7. So, and I
mean,
send that,
you could-
but
you could be
I
horny
don't.
24/7
I mean,
and not get hard.
there were also the times that I was at the gym. Maybe somebody got me hard, which is good because if you're at the gym working out and you saw some little hottie out there and you're trying to get hard, so you're kind of like trying to cover yourself, or you're trying just not to make it obvious. I mean, there's some people you can tell walking around with a heart on, but you can also tell that they're very, very, very gay. But when I went to the gym, like nobody really knew I was gay unless I told them. So I was there to work out and bullshit with the guys and everything, this and that and the third. So you don't want to be getting hard because now they're gonna be like, yo, check out this faggot. Yo, why is he getting hard? Well, shit like that. But there's times that when you're working out, you see somebody, you're gonna get hard. Even if it was somebody that's straight looking at a woman.
You're back in the dressing room, you see somebody and you get hard. That's like,
I mean, getting hard is a natural thing. People get hard for different reasons. There's most likely there's some guys that work out and get excited working out.
Right.
It's like saying Leo is running around downtown or at the mall, sees this cute guy in some little shorts. Oh, let's put it this way: sees a guy in little shorts and has a nice butt. He may not be attractive, but it turns Leo on because of the shorts and the butt, how he looks. I mean, there's reasons for someone to get hard so many ways. But the thing is, when I talk about you getting hard, we're talking about you not getting
The thing is,
hard.
staying hard is the biggest question. I can get hard, and I'm just saying in general. Staying hard when you take somebody home and you're about to fuck and you're there, a minute into it is like it starts going down. Like there is your ED.
Now, yeah, or they show up and you're like raging hard. They show up, and all of a sudden you're not hard anymore.
But are you not hard because now you were turned off by their appearance, or you not hard because you're just not hard? Period.
No, I'm going to give you an incident where it happened with me. And this wasn't a hookup. This was somebody that I knew. They came over.
It's nothing about us. It's someone
Yeah.
who always knew. Go on. I'm doing the same thing, but go on.
Yeah. It wasn't a hookup. It was somebody. Well, I guess it was a hookup, but it was somebody I knew. So I knew what they looked like.
Right.
And I was like hard thinking about them coming over. And just before they got there, it's like, boom,
No. Do the sound.
plop.
What was you doing earlier? What was it earlier?
Yeah.
Okay, well, if that happens,
It went up inside and hid.
Jase, say that happened to you. Okay, this hot guy that you hook up on Grindr is coming over. You're super hard, and as soon as he walks in, you go limp. Is there anything you could do that will get you hard again, or completely you're just?
No, I've had this happen where the guys got down to
That's
suck my
part-
dick.
Okay,
He's trying to
actually.
jerk me off, whatever, to get me hard, and I just won't get hard.
Really?
Yeah.
They might start blowing me. It's like if I started going limp, I was like, yo, I just grab them, make them fucking blow me. Sometimes, this might be weird, but just them tickling your balls, or even playing with your asshole. How many women have had to do that to their husband or boyfriend, where they're playing with their asshole to get their husband hard?
That is something that I've never had them do. Because think about it, a man's G-spot is actually his prostate.
Right.
So reaching in there and tickling that I've never had
It could
anybody
be
do
a
that to me.
puzzle.
So,
Well,
They've never done that to you?
And
no,
make sure you
well,
say-
I have, but
You never
Huh?
done it?
Make sure you say coochie coochie coo.
Well, I mean,
Look,
I've never done it after I've gone limp.
smell,
I've never.
smell.
Oh, get out!
it works. You just go tickle, tickle, tickle. Why are you blushing? You know it has happened
Oh my
to you.
God. No,
But
actually,
wait, you know what? We've been talking a lot. What about Wayne?
What
What
about
does
you?
Wayne have to
Anybody
say?
go coochie coochie coo?
What do you ask me? I'm so into a conversation.
ED. What do you feel about AD? I mean ED.
Why?
What do you feel? I mean, has it ever happened to you? Do you feel after you started doing drugs? Because you've mentioned it before that.
Well, the drugs totally destroyed my body, so now I'm rebuilding things back.
Right.
And when I started getting past it and not having the dysfunction, then we accidentally change a psychiatric medication that would then cause it, because I have to constantly watch interactions with HIV medications with psychiatric medications, because so many of them clash. Biktarvy's the first one that doesn't clash so far that we know. But I mean, there's even things coming out. I was on Stribuild. Stribuild does things now that they found out.
Well, a quick question: do you think that sometimes? I sometimes think it has to do with the amount of medications that I take.
Well,
Not that any of them
it
fight
will.
each other. It's that I take so damn many of
Well,
them.
when there's so many of them, your liver is using so much of what its enzymes to break that down that it also breaks down the dopamine in your mind, which the dopamine will need to produce to make you have an erection. Dopamine's the good feel thing.
Yeah.
Okay, let me ask you a question, Mike. Are you going through those issues right now? That is
Yeah,
hard
I
for you?
am. I mean,
Okay, you have a partner,
Mhm.
and how do you and your partner deal with it?
It's hard.
But you're managing somehow,
Because there's a lot more to that than just sex
Okay.
in our relationship.
Oh yeah.
Because
That's true, actually.
Your relationship with your partner, I'm not gonna say his name, but with your partner, it's fresh still, it's brand new still.
Yeah.
And for this to be happening in the beginning, do you think down the road it's gonna become a problem? Or you guys are talking about it, working things out? Saying
Actually, we really haven't talked about it very much. It's just a known thing, and like I said, I'm switching medications around and things like that. But there's just, you have to get the right thing. There's so many things that interact with HIV medication on the psychiatric side.
Okay. When you say it's an own thing, in other words, he's aware that because of the medications you take, there are times when you don't want to have sex, you just want to sleep.
No, it's not that I don't want to have sex. In my head, I do. But physically, in my body, it won't match up what's going on in my brain.
Okay. But and your partner's
So-
aware of that.
Here's one thing that I've met.
I'm sure it bothers him, but luckily enough, I have a good enough person. At one time, he did make a comment. He goes, "Damn, that medicine does have you fucked up, doesn't it?" Yeah, it does.
There's a few people that I've met that were addicts, and they were so dependent, being high, being on this and the third, that now that they're not on it, they cannot get hard. They feel the only time they could be hard or do their best performance was when they were high.
But you see,
The reason to that, though, and I just had this discussion with the doctor on Monday. The reason to that is because if you're using certain drugs, especially what's big in our community right now, is methamphetamine. Methamphetamine quadruples thousands the dopamines over than what your natural body would make. So when you quit the methamphetamine, your body does not make you don't have that sensation that you did on it. You just got a regular, actually, you don't even have a regular dopamine. You actually have lower dopamine because you damage that part of your brain, and it takes a long time to get it back. When I saw an echo, because of something that happened to me physically when I had that slight stroke, I had to have a CAT scan done on my head. Now, I had only been off methamphetamine about a year, and it was unbelievable what my brain looked like. There was like, you're supposed to have a lot of red and things like that, and I had that much red right here in the top. All blue and green back here, and real green back here. When I had this last one, I still had only half of the red had come back.
You mentioned meth. I have a friend who does ice, and he's talked about the fact that actually ice doesn't. It'll make whoever horny, but it doesn't necessarily make them hard. In his case, he can't get hard.
Yeah, it just relaxes you.
Like you were saying, some people need to be high to get hard. But here I go again. I know a friend who knows a friend who had to get high as hell. Okay, I'm talking about Leo. and who used to get a high now to get hard. But in reality, in his mind, he was hard, but he wasn't hard.
Because methamphetamine, after a long, you do get hard and stuff at the beginning, but after long term, like I said, it starts breaking down in the back of your brain where all that is made. It starts breaking that up. It's not red like it's supposed to be, and it quits making it. At one point, it made lots of dopamine, but now that it started to damage it, it does not make the dopamine, which then again does not allow the arousal.
So now I have a question for you, Mark. So do you feel if you ever got ED, would you end up being more of a bottom?
No,
Or were you just not having sex at all?
not having sex.
Well, I mean, basically, he's at that point now. I mean,
That's where I'm at right now, I guess.
Oh, I think you'd slip a finger in there.
No, it wouldn't do nothing. It just
Two fingers?
I don't care for sex. It is. I'm not you, Jerry.
Jerry went like this.
Yes. I don't care for sex. To me, sex is not important. To me, the emotion, how can I put it?
Emotional.
Yes, that's more important. And to me, that's sex. That's a turn on.
It's kind of played out.
I go with the what?
It's kind of played out.
no,
It's just I
I'm
get
kidding.
turned on more by having a partner that I do have right now that is there for me and I'm there for him. And to me, that's the biggest high in a sense for me. I don't need to get hard to.
Sorry, you listen to him.
I don't need to get hard to show my affection.
So do you feel the older you're getting, the less you want sex? I mean, all four of us, we're all pretty much around the same
To
age.
me, I started giving up sex probably 20 years ago. I'm 51 right now. I was 21, I guess, where I decided I really didn't want sex anymore.
that's where the secret
It
older I
wasn't
get, the
'cause
more I
I
want.
didn't get hard because I did. Now, to me, it's I don't care if I do or not. I really don't. It just, is it right for my partner? He accepts me, he knows who I am, and it works for us. Yeah, people do talk that know me, know what I'm going through, knows me and my partner, and they will always talk. And I'm okay with that because it doesn't bother me. If you're gonna talk shit about me, go ahead. I mean, it does not bother me. I'm not that petty. I can move on. I know where I stand. I know where he stands. As long as I love him, that's all that matters.
And that's
He
good.
loves me. That's all that matters.
Well, you know, it's weird because I'm going to be 59 on Friday,
59?
59, and
You're old as fuck.
I am getting old.
And,
But I feel like for me, I want sex more as I'm getting older, but yet I have the problems with the ED. So, and I have actually thought about
The pump?
the bottom.
The bottom?
The bottom.
Bitch, you are a big old bottom.
No, I've always considered myself a versatile top.
Right.
I
I mean,
mean-
and you know what? And not to cut you off, I think we all start, I'm fucking top, blah, blah, no one was gonna touch my ass. And then the older we get, or the more ED we get, or something like that, okay, now I'm verse, or I'm a top verse. Or then it becomes now you're a verse. So what happens later on when we definitely have ED, and we're in our 60s, or 65 right here, do you end up just being a big old bottom? And then you end off. Yeah. So what happens? So again, that's a mind thing that fucks with you because you don't want to be that bottom.
and you become that bottom. You don't want no one to.
And okay, and let me
But
get
you
this.
still
Let
want
me
the
get this
sexual
straight.
pleasure.
We are not bottom shaming nobody.
No.
No.
If that's what you prefer that the dick. Hey, it's all about you. Go for it, dude. But we're talking about the tops that are getting ED, that are either ashamed, don't want to talk about it, and or are just confused.
You see, it's a big problem with tops. For a bottom, I personally don't believe it's a problem for them because a true bottom. This is how I see it. I could be totally wrong, but this is what I believe. A true bottom will not top. A true bottom doesn't want to use his dick. And if he has that problem, he probably doesn't even know himself that he has a problem because he doesn't use it.
Right.
And a lot of bottoms don't like their penis to be touched.
Not true.
I know you're a bottom, you can speak in a minute, Jerry. But I'm gonna ask Leo, as a verse, when you bottom, do you like your penis to be touched? I mean, like I said, it works both ways. Sometimes yes, most of the time no. That's my
I mean, I don't know,
This is so technical. I don't think about these things. I'm just like,
Yeah, that's a look on his face like,
hold on.
wait a minute, do I?
Oh, yeah.
I guess no.
Why? Because you're there to bottom, you're not there to use. Honestly, and this is the way you see it. A bottom is not there to use his penis. A bottom poop, this is the way I see it. A bottom poop climax without coming.
That's fine.
And actually-
if you do a good job,
Actually, if you do a good job with the bottom,
Yes.
they will come too, even
yes,
if, whether they're hard or
without
not.
touching them, or without them touching themselves. And I'm not saying every top does a perfect job. I personally, I think I do an okay job. I'm not gonna say I'm up there because honestly, I've been with a bottom who, I'll tell you the truth, he was so loose that I could put my foot in it. Okay? And he still would not climax because he needs something bigger. I'm not saying I'm small because I know I'm not small, but I'm not big either.
Ooh, somebody's proud of their
hold
face.
on. I'm saying I'm not big either. I think I'm a perfect size. But
Poor guy.
some bottoms are loose. And I could say the same thing about a top. Some tops are so small where a bottom doesn't feel nothing, and it just works both ways. They think they're the shit, and in reality, you're not even tickling them.
We're reading something.
Okay.
I couldn't shout. I was like,
Okay,
trying
I'm
to get
sorry.
it, so I just passed it.
Milton puts on here, he's, from when he was in high school, a lot of guys in high school walked around in the locker room after football practice with an erection. Okay.
Yeah, I see that true because
And then about
when I was in junior high,
and then it also says when he was an aerobics instructor.
okay,
When he was an aerobic
when
instructor.
I was
So with the
in junior
bodybuilders,
high, I was
That's
a
a
top
dry
boy.
orgasm.
For the football team,
You were what?
a top boy.
Oh,
I
top.
would- yeah, I would be the top for
I
football.
thought you were the
That's a
fucker.
real thing.
And yes, remember that's a real thing. And I would say, shut up. I would say 75% of the football players were hard. It's not because they were getting turned on by other guys. It's just the excitement of the game itself turns them on. It's the same thing as someone working out. If you enjoy working out so much, you could yourself get so excited without realizing you have a heart.
See, I don't know. I mean, two scenarios. When I was in the military, we were in there. John could vouch for this too. Oh, and you too. Whenever we had to go take showers, especially in boot camp, you had to go in there, take a shower. You did not have time to be looking at anybody's dick.
But
You had to go in there.
it's totally different from
Right.
military and
But you
football
could tell that one person that was just just looking around and started getting hard. So even when I was wrestling in college,
But you see that by doing that for a guy to do that does not have to be gay. Even straight guys get hard in the restrooms because just the excitement itself.
Right,
seeing
and
a nice
I understand
ass,
that.
And in their heads, they get excited about it. It does not make them gay or anything.
I understand that. We're just talking because you brought up football. I when I wrestled in college, those guys were secure but insecure. There were a couple people that I knew that you would think, this dude's got a big ass dick. He's just gonna be swinging it around. No, that one was the one that was more private. Like he'd be that last one to go take a shower, and he was high as shit. And there was another one that would just swing and dick, just show you. Just put it in front of your face.
Okay, the wrestlers, I've been to a couple wrestling matches.
And I'm talking about college.
Okay.
No, I'm not talking about WWF.
No.
Steroid.
I'm talking about high school.
Steroid
I'm talking
wrestling.
about
Yeah.
high school, where they have the little tights on, wrestling, and all that. I would say 90% of the time, a guy would stand up, had a hard on. Okay?
Yeah.
It's not because it was a gay thing. It's, to me, is just, I talked to one of the guys, he turned around and told me it was not a gay thing because he was straight, he had a girlfriend, but just
The euphoria,
you're
arousal.
grabbing someone in positions that's where your penis is touching their ass or on the thigh, you're gonna get hard
Yeah.
because of the friction.
I was gonna say a lot of it has to do with
Yes.
I mean,
I have,
You'll get hard.
I have two nephews that are wrestlers, and one of them almost got in a fist fight with a guy because he had him in one of those moves, and the guy broke out of the move and jumped up and said, "Stop putting your hard dick up against my ass," and they almost got in a fight, and it wasn't his dick, because he had a cup on, and that's what he was feeling, and he almost got into a fight over that. Wrestlers, believe it or not, do not, if they're not gay, do not appreciate feeling another person's
No.
dick against their ass.
No, I mean,
So-
but those are the ones that usually look the hardest. I mean, you can see football players and everything, not really basketball players or even tennis players, but wrestlers, because they're wearing that tight unitard. Yo, it's just like, yo, like, dude. But, you know, we're not trying to change the subject. The subject is about ED.
Yeah.
You know, it is a hard subject for a lot of us to talk about, you know, to even say that they have it. I mean, how hard was it for you to say right now that you've had or you're having?
Right now, at this particular moment, it's not that hard, but it has been a very hard discussion for me to have. It's taken a lot of discussion for me to be able to sit up here and say,
And especially among
I have
friends.
issues with ED, you know, a couple times a month.
Yeah, because I mean that's not something you talk about with your boys. I mean, I know when I was straight, it's like I don't talk to my boys. Like, yo, I couldn't get hard or anything, because they would fucking laugh at you like you're a little bitch.
And
That's what they tell you.
and that's macho. What's the word?
Machismo.
Yeah, machismo. People just, oh, you're not gonna say that to your friends. They're
Yeah.
you want them to think you're doing it
So
every
for,
night.
even for us to talk about it, that's us breaking a barrier. Even though we're talking about TV, I mean, online right now. Is anybody else, Milton? Have you had it? You know, anybody else that's on there? Have you had ED? You know,
And
be
are you
safe
willing to
about it.
admit
If you
it?
have it, you have it.
He said he had
Okay.
said way earlier that he's had
Well,
it.
I
Yeah,
haven't
yeah,
read
yeah.
it, so
But
I don't know.
He said, but what he said was is about what you're saying. He says it's emasculating. Which is
Yeah, it is
Yeah.
emasculating because you don't want other people. Because what are they gonna do? Oh, they're gonna go tell other people. Oh, this nigga cannot get his dick hard. Blah blah blah, and make you. And then they go to like. Now they don't want to. It's like, oh, I heard you're bottom because you can't get your dick hard. Or like, whoa, where'd you get that shit from?
Well, you know,
You know?
to be honest with you, I think for me it's been easier to talk about it because there are a few famous people who have decided to talk about it. I mean, the former Senator Bob Dole, he had problems with ED. And when they first came out with Viagra, he actually talked about taking the blue pill. I mean, it's people like that, because it's more common than you realize, especially as you get older and if you're taking medications for diabetes or HIV or anything like that, it is much more common, just like you read in the article. It's very common within the HIV community. And we need to realize that and need to realize it's okay because it happens.
And you've seen a commercial at least once an hour during the day. You will see a commercial of, do you have erectile? Or do you have ED? Blah blah blah. Well, this is the cause. Blah blah. And you mostly see it at night. Let's say after 11 or something.
Yeah.
Boom. Every other commercial is probably like an ED commercial when you're
So-
swooping through.
since you
because
said that-
they're targeting the men that are staying up at night.
Yeah. Since you said that, my favorite commercial, it was a Super Bowl commercial. And there was this old man, he had the blue pill, and he had it in his hand, it bounced out of his hand, dropped it, and it goes down the road, bounces through this, bounces through that, winds up in a gas tank of a car, and that car suddenly goes, woo, 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 and takes off on its own.
But, you know, if you're taking that pill, you better be careful too. Because if you take too much, you know, again, it goes with the milligram.
Yeah, that's right. Matter of
You
fact,
know, if you take too much,
if you have an erection for more than 4 hours,
you need to get
go
your ass to the hospital.
Yeah, that's right, to an ER, because that can become a life-endangering situation.
And what they'll end up doing is putting a needle and draining the fluids out of there.
Ooh,
Because
I didn't know that hurts.
Huh?
I didn't know that hurts just thinking about that.
because how else would they do it? You think they're just gonna
I
pet
know,
it
I mean,
and go down?
well, I didn't know how they did it, but
have
it's
to
like-
drain it out, dude.
Oh my God! Now that I know that,
Yes.
I thought
no.
they put an ice pack or something.
No.
Oh my God! I'm hurting just thinking about that, guys. Oh my God.
Okay, let me ask you guys a question. All three of you. That's, and if you had a problem, who would you talk to?
I'll talk to my doctor. I don't know if I could really talk to y'all. I mean, you know what?
No, actually,
we are. I guess I could.
Yeah.
But because we're all talking about it, and that, you know, and we're learning about each other, that we're more sharing more. That it's like, okay, you know, hey, fuck, you know, I'm feeling comfortable that I'm talking about it on what should we call it, online.
No, this is Facebook Live, not
On
what-
Facebook Live. But you know what I'm saying? But if we were on Facebook Live, would we be talking about it amongst each other? I doubt that.
Likely no.
Huh?
Most likely no.
Most likely no.
I mean, I would have no, if it was a major issue, right now I don't consider it a major issue because it's only a couple times a month. But if it was to become a major issue with me, I would feel very comfortable talking to anyone in this room about it. And yes, I would then talk to my doctor about it as well.
I'm reading it saying they inject saline to make that blood thin to go out of the penis when it's hard for 4
Still, the thought of sticking a needle down there just
yeah.
hurts.
And then and then they also can give you a drug called an orphan drug, which is used to treat severe bubble boy immune deficiency.
I'm sorry, what again?
Bubble boy, you know, people that have to live in a bubble because they have no
Oh, yeah.
immune deficiency, that they can give
Okay.
you that drug. They call it an orphan drug. They
No.
can give that to help it.
We're trying to break down the stereotypes of, you know, again, being machismo or being a power bottom, doing this and that and the third, you know, we're not trying to shame nobody. We're trying to just,
What we're trying to do is say it's okay to have these issues and talk to it.
Yeah.
Whether you're talking to a friend, a counselor, or a doctor.
we're doctor.
Matter of fact, truthfully, I would say the first person you talk to when you start having these issues should be your doctor.
Well, I thought,
And your psychiatrist.
Yeah, a psychologist, counselor.
with me and my doctor, I mean, like, I guess with everybody, I feel that everybody should have a really good relationship with your doctor.
Right.
With my doctor, I can tell him anything, and he will sit there and listen to me. And when he asked me about my sex life, this was quite a few years back. When I met Dr. Martinez, he asked me about my sex life, and I told him how I felt. And he's like, okay, let's look into it. And I'm like, we can look into it. So he did blood work, blah, 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 did all this. And he told me, I mean, you should have a normal, thriving sex life. I said, I do. It's just, I just don't want to have sex. That was my choice. And then down the road, a couple years later, he brought it up again. He asked me if I wanted the blue pill or what have you. And I said, no, there was no reason for it because I do not want to have sex. I just don't. I'm to that point that it's nothing for me. It doesn't do nothing for me. And I know I'm not the only one. But, and this group is totally different. We got someone over here, Santiago, supporting 24/7. We got Jase who plays for himself 24/7. That's what you said earlier, don't go there. And we've got one here that who he is and dealing things with his partner. We have, and then you got me who just does not want to have sex. We're all different. We all deal with it.
And then we have Leo, who's just Leo.
But the thing is, how comfortable do you feel? I mean, if you had a female doctor, like, how many of us have a female doctor?
I do.
Who what?
A female doctor.
Everybody on my care team is female.
I cannot have a female doctor.
I have a male doctor.
I feel more comfortable talking to my female
Yeah.
doctor. But then again, it's because growing up as a child, my original doctor was a female.
Okay, I'm
And I
more
think that's
comfortable
right.
with a male doctor because he will understand what I'm going through. A female
Exactly.
will not.
See,
That's
and
why I cannot have
the
a female
reason I
doctor.
argue that point
Question
is,
over there.
Well, I'm just gonna comment. Brewster has a male human.
What?
Brewster's his doggy.
No, I'm his male human. He owns me.
So your dog has been rubbing his dick all over you? What are you trying to tell me?
He just owns me. He barks and I do whatever.
See, that's bestiality, and that's another episode. We don't talk about that right now.
Along with the gerbil.
but what I was doing,
Does Brewster suffer from ED?
Well, he's fixed.
but what I was going to say about
Then he's not suffering. He just fixed. Go ahead.
what I was going to say about a male doctor, why I do not like them, is even just recently I go in and I said, look, okay, now I have a hernia from surgery. I've been born with 2 hernias, whatever. He gets there and he stretched those babies as long as he could pull them down. A female would not do that. A female is very aware of what hurts a male, I feel like. I have a full team of females on my care team because that's how I put it. I do not like men doctors, especially older ones that came from the army and shit. They're rough.
Matter of fact, the only male
But
doctor
because
I
but
have.
that's why you said, because he came from the army.
Yeah, they're
but if he would have been a regular doctor, well, just a regular civilian doctor,
Yeah,
let's
but
go with that.
the German
it might
one,
be
I
different.
mean, the general surgeon that I had too, that was just.
Like my doctor's cool as fuck. My pharmacy doctor, when I tell him, look, I just did this weekend, and he was like, okay, so you need a penicillin shot? You know, I'm like, yeah. And so, and now my social worker, she's a female, but she's like a tomboy. It's like,
Next one free.
thank God I go to the VA because I get all my shots for free. You know, I'm not going to say where I live again, but you know, they already answered your question.
I know where he lives if anybody wants to know.
They
But-
got petri dishes with your name on them out there.
But you know,
Parking spot.
I do have my own parking spot. Thank you very much. Yes, ma'am. With the curly hair.
Oh, you're just stretching?
Stretching my.
Okay.
Oh, okay. We thought you had a question
Yeah.
or comment.
You know, the thing is that there's alternatives, but whatever you choose or decide to help you out, you got to be careful. I mean, he just told us about a gerbil story. I don't know if I'm gonna bring the whole story up, but doing stuff as dangerous as that with a gerbil, please be careful. But
And that, you know,
what-
truthfully, when you do
whatever
stuff like that,
arouses
your
you,
doctor should
arouses
know.
you. But just be careful of what you're doing to arouse you. You know, if it's something that you know that's gonna hurt you, talk to your doctor. You know, if you're not that comfortable with that doctor, just say, hey, can I speak to the PA or can I speak to somebody else about it? Because we don't want you going up there sticking something up your ass just to get you hard. You know, even when you're taking over-the-counter medication. Again, like I was talking about, when I used to work in GNC, I used to have all these older guys, oh, I need some horny goat weed, or what was the other one, Yahumba. There was a couple other things that people would buy. They would pretty much buy like $200 worth of crap.
Have you heard of this stuff? Because I've looked up all the different things. Panax ginseng,
Yes.
and then Rhodiola rosea.
Oh, something root.
DHE, the one before.
Is it ginger root?
Hold on.
Chinese medicine has.
Yeah, Chinese medicine.
So
I mean,
the first one, Panda is ginseng, so that's going to probably come from a ginger root. It says it's red ginseng, basically. And then Rhodiola rosea.
you know, again,
It's
going
natural,
back,
so it's
But
gotta be-
these are all natural.
all these are natural.
DHEA.
You know, and if it helps you out, hey, go for it, dude. I mean, I'm not stopping you. But also make sure you take your multivitamins too. That's not harmful.
But if you don't take medication like that over the counter, talk to your doctor.
I was
Yeah,
gonna
that's
say
what I'm
you
going
have
to.
to-
Talk to
because
your
some-
doctor.
because
And then
some-
your doctor, if you got a really good doctor or pharmacist like I do, they will tell you that's crap. You have to take like hundreds of pills for you to get like a boner that's gonna last you like 5 hours. You know, it's like saying when during Thanksgiving, if you eat turkey, that's gonna make you go to sleep. No, you have to eat the whole turkey to actually make you go to sleep.
Yeah, I just want a turkey. I want to take a nap.
But you have to be
But that's a
careful.
mind thing.
Yeah, but you have to be
It's just
careful
like-
with
it's like
you
herbs.
have to be careful with vitamins because my doctors even told me, my HIV specialist even told me you need to be careful. Don't take vitamins over take it upon yourself. I'm gonna take a vitamin
I'm not-
because they can interact still.
See,
But we
my-
still need-
My doctor told me not to take over-the-counter vitamins.
Because
But does he prescribe it?
No, he does not.
Okay, but also you have other issues that you cannot take.
Yes.
Okay,
As us as
my HIV meds it affects my HIV meds, my heart medication, and it affects my diabetes medication.
Do they tell you should? The reason I ask is most people with HIV, they recommend that you take a vitamin D
Yes, supplement.
supplement. Which
I do. I have to take it.
I take
because my vitamin
2,000
D and my vitamin B are
units a
so
day.
low. My vitamin B.
They usually prescribe the D though, right? The 55,
Yeah, I have. It's
55,000.
vitamin D3.
Yeah, 55,000 milligrams.
Vitamin D, I was prescribed because my metformin I was told to please comply.
Yes.
Yes.
And that's why I was,
And that's why you got, like,
That's
I
probably
take
good too,
metformin
yeah.
as well for my diabetes. So I have to take vitamin D as well. And I'm supposed to take an aspirin too, a thinner, a baby aspirin. But if you are about to go to surgery, like I have to go to dental surgery. You can't take, you have to stop like a week prior because you're just gonna bleed. Like the first time, I think he took me,
No, you're right.
I was bleeding like crazy. I would not stop for days.
I'm supposed to have surgery on my ear, my left ear. And the doctor did tell me when I talked to him that some of the medications, he was going to talk to my doctor, some of the medications I will have to stop before I have the surgery. And he was going to talk to Dr. Martinez and figure something out because it does affect, like you said, it makes you bleed or something.
Yeah, it just, because it's a blood thinner. So what ended up happening, you're just gonna keep on bleeding and bleeding. So, right, they didn't tell me the first time I had a root canal or something like that. So he had to pick me up because like, if you're doing a root canal or something, major surgery, you have to have a driver because all the stuff they give you, you're just all drowsy. So I went home and I just kept on bleeding and bleeding. I had to call my doctor and I had to go back and it was like, did you stop taking your aspirin? It's like, you didn't tell me. So they told me to use something, but they also told me get the tea leaves, the green tea leaves, or the black tea leaves, and put it in my
The actual leaf, tea leaf?
no, not the leaf, but the tea the little tea bag,
okay.
and fold it over and put it in there. That the chemicals in the tea bag would actually help it heal, and it did. As soon as I put it, boom, I stopped bleeding. Not like right there and then, but. You know, I stopped bleeding. So now every time I go for the dentist or something, I just stop taking it. Actually, I think I just stopped taking my aspirin.
Okay, we know medication could affect you to get hard.
Right. And it could be any medication.
And what was the other effect mentally?
There's mental health and stress. And then there is physical issues that a person can have. In the case of, let's say somebody has testicular cancer, it reduces the testosterone in your system, so that can cause ED.
Just gaining weight. Gaining weight.
Gaining weight.
Oh, I did. I'll be the first one to admit it. I did gain some weight.
Yeah. Well, I think, I should not say we all. I know I did too.
But we all call it COVID weight right now.
Yeah, we call it COVID weight. Yeah.
We all gain weight, especially after COVID. A lot of us got a little fluffy.
Well, you got to understand.
So fluffy!
Well, we got COVID, we got sick, and we were not eating. And then when we got well,
Yeah.
all we wanted to do
Was
eat.
eat.
I mean, I think I told you, I lost like 15 pounds when I got COVID. Yes, I fucking feel great. My birthday, I weighed myself, I was like at 220. I'm like, yes! 2 weeks later, boom! COVID hit me again. I got weight, I got fat.
300.
Fuck you. But again, going back to the medication,
So I'm looking at that also. So here it says that men that have ED, 75% of it is caused by medication.
But is it due to your HIV medication or just medication?
Just medication.
Just medication in general.
So it could be your diabetes medication, it could be your
Yeah.
HIV medication,
But some of those psych
your heart medication, or something like that.
Some of those psych medications that
Psych meds, yeah.
the doctors give you also screw up with your erection.
do both of them.
Yeah. I mean, I don't know about Gibraltar, but and I've mentioned this before. I am diagnosed with depression and anxiety. So
Love you.
what?
Love you.
I love you too, bro.
That's what we called you.
So I don't remember what I was gonna say. I forgot. So I do suffer from depression and anxiety. So some of those pills, I have to take one of them twice a day, and one of them I take once a day. But they're big pills. One of them is 3 little freaking pills. It's called Fluxetine.
And how do they affect you?
They just bring me down. It's like I'm lazy. I don't want to do shit. I just want to lay down. I just want to sleep. So I want to take it at night, but my doctor says no. You have to take it during the day.
But
Why?
you see, and I mean, this could be a good topic down the road. But medication like that supposed to make you feel good, all it's doing is bringing you down.
It's bringing you down if you're not going by doctor's instructions.
Right.
You have to stick with it. Every time I change something, you can ask Richard, I will lay in bed for days. He has to kick my ass to get out.
That would depress me
But it
more.
takes time. It's not, psychiatric medications don't go like that overnight. You have to, some of them are up to 8 weeks before they're effective. Most of them about 3 weeks. You can't go, oh, the first day, oh, I don't
No.
feel, and then stop using
But
it.
when it does hit me, it hits me hard. Sometimes I just have to weed myself out of it. And then I'm a little bit more balanced, but I have to take it. If I don't, I just end up going down. And when I go down, I just don't want to deal with nobody. I just want to be a hermit.
I don't want to say scary, but are you worried that it might affect you down the road, taking all this medication, depression medication, that you probably will not get hard down the road? I mean, because a lot of psychotic meds, that's one of the side effects, that you will lose your erection. And by taking so many meds, after a while, there is no coming back.
If that happens, I'm gonna call, what's that website? Him, where you get the blue pill.
Oh, yeah.
I need the triple pack, cause I'm still fucking horny. Just because I can't get my dick hard.
All right, I was going to ask, because it is him. It is the little blue pill they give you,
Yeah.
is that like a generic form of Viagra, or
Yeah,
is it a generic
I
form?
guess I'm only saying that because it came up earlier. Him, and it gave me a brief description and everything. If I have to start depending on stuff like that, I'm gonna have to do whatever I have to do to keep on being a top, I guess. If I have to if I have to inject my dick every fucking day or every time I'm gonna fuck somebody, I'm gonna do that until I can't get hard anymore. Then the option is either go celibate like you, where you don't want to have sex anymore, or be the biggest puta like Jerry and be a big bottom. I'm just kidding.
Not just the bottom.
But if it comes down to that, but I'm not gonna have sex. I can't. I just love sex too much. Not that I'm an addict,
But you see that, okay,
but if I become a bottom, I become a bottom.
yeah, but that could obviously affect you more, because if you cannot have sex no more, being the top, and you become a bottom.
But I'm still getting some kind of pleasure. It's worse when you're getting no pleasure at all. I think that's going to put me more in depression, that I'm not getting nothing. Again, that's just for me.
Yeah, true. Like I said, to me, my pleasure is just to be with someone, not sexually, just to be with someone.
Oh, we all want that. We all want to be with
Yes,
somebody,
but
which
I
is
get
worth
my
our time.
satisfaction, my high or my climax, just being next to him. It's just, we may be in the same car, not say one single word to each other. It's just to be next to him. That is where I.
For you, it's the emotional connection, the mental
Yes.
connection
Yes.
versus the physical.
And a lot of people ask me that if he is the love of my life, because of that itself. I've told him once, I don't know if you remember, now he remembers everything he says, but I told him once yes, because I've been with my partners before for 15 plus years, 9 plus years, 8 plus years, 4 plus years, and they have lives. This one is different. He is different. I don't know how to explain it. He is different.
He's a good guy.
Yeah, he really is.
We all love you, little pork chop.
He has a beautiful heart, but piss him off. He's a little,
He's a little demon. You can
Yes.
tell.
but in reality, he has a beautiful heart, and he understands where I stand, and he's there still standing by me. So I got lucky in that sense. But there's other people out there who, I'm going to use Jase as an example. He's with a partner because God knows he will never find someone. But just say one day he does. I love you, Jase. Just say he actually
However, it
found
may be
someone.
true.
Okay, how about this?
But no.
How about this? Him and Benjamin somehow became good friends. Just saying. You guys became good friends, and it became more than friends.
Friends with benefits.
Yeah, not friends with benefits. it became more than friends.
it's
Where, in
there was an
sense-
emotional connection.
Yes, emotional connection. But Benjamin still can get hard. He cannot. And they're discussing, hey, let's have a sexual relationship now.
But
So,
how's it gonna be
hold
two
on,
bottoms?
No, it's a top.
I think that when it comes to that, it's going to be between that person, those people.
You see
None
that?
of us know.
It
None of us
is.
know. None of us know when
It's
this is
a
going to happen.
it really
We can
could
sit
work.
here all night long and talk about this, and until you're in the situation, you cannot answer
No,
that
that's right.
question. And I don't mean like in between them, just in general with the erectile dysfunction. Well, will I do this? Will I do that? If it's not currently happening to you, there's no way you can answer that.
But
You
what
just
I'm saying-
can't.
but what I'm
You
saying-
think you can, but it
Sure, but what I'm saying is, what happens in a sense, they do love each other, but for Benjamin needs a sexual connection. And that's where you get hurt. Because you know you cannot get hard. We know you could. You can.
But let's say I
I'm saying
didn't.
That
Yeah.
you couldn't. And that's where the problem begins. But in situations like Wayne said, no one knows what's gonna happen or what anybody's gonna think. But there's situations that does happen that you could find love without having sex. And it could happen. Things are working out for you at the moment. And hopefully they will work out.
I can't. I don't have my glasses. I can't tell if you're looking at me or not.
Yes.
Okay, because I'm trying. I can't read the screen. I don't have a bifocal on
Okay,
this.
things are working out for you right now. And hopefully they'll keep on working for
You never gonna be the
We're
bridesmaid.
happy for you and your partner. I'm not saying his name because it's just out of respect.
Hey partner, how you doing, partner?
So you're happy. Santiago's happy in a sense being single.
No, wait. It's not that I'm happy being
because
single.
It's your choice to be
Right.
single. You always said that. It's your choice.
It's
to
my
be single.
choice. You know, I would love to be in a relationship. I would love to be married. I would love the whole
White picket fence.
the house, the picket fence, having some little kids. I would love that. But again, I'm not just gonna settle for somebody because I want that.
But what happens if you don't find that?
If I don't, I don't. But why am
But
I?
you still will be happy in a sense.
Right. But I just don't want to choose somebody just because I'm going to be 51 and I feel like I should be married. I mean, yes, I should have been married by 50 or remarried, you know, and have that retirement life. You know, we both have good jobs, or we both have steady income and have a great house, our kids, our families, the aunts coming over to watch the kids, especially this one, the grandmother, aunt.
I was about to say that too.
But, you know, I would love that. But at the same time, and I've said this, I'm not going to settle. You know, call me picky, call me choosy, whatever. But I'm not going to settle. You know,
But
you're happy.
when it comes to somebody you want to spend your life with, I don't think you should settle. I think it should be a person that you feel the comfortablest with, the one that you know you can go through the rest of your life with. And I don't think that's being picky. I think that's being realistic in a point of view that, because if you settle, then you're not going to be happy.
Right.
And you're not going to enjoy that white picket fence.
Exactly.
Okay, what
I mean, because a lot of women do that.
Hold on. Let's go back to
There's a lot
erectile
of women who do
dysfunction.
that. There's a lot of women who do that, and there's a lot of gay guys who do that.
Yeah. Well,
I mean, to me, I find it extremely funny that you know this person B meets person C, and 2 days later they're moving in together,
oh,
and 2 days later to a week later they're at the courthouse getting married. To me, I don't think that's possible. I could be totally
no, you're right, because it's
No,
either,
actually,
it's either one thing, for one thing, either the dude is well endowed, or he's got money, or somebody needs papers.
See, no, I disagree there. I think,
I'm just saying,
yeah, that's
from whatever
that's true.
country he's from.
That's
What
true,
about love
but
at
I do
first
believe
sight?
that there can be love at first sight. And I believe you can
So
meet
let's go
somebody
back to
and know
this.
that
Can
it
we
clicks.
have love if there's an erectile dysfunction?
I mean,
we have
no,
people answering things.
there
We're
is
on a
love at
whole
first
different
sight.
section.
I mean,
We are
John,
kind of
John,
doing-
how long you been married? 21 years?
Yeah, he's been married for 21 years.
John's been married 21 years. With, well, I'm sorry, 20? 21. No, it was right, I did it. In 21 years, and he's been with that same partner, like I said, That's the first guy that you actually ever dated, right?
I never know anybody else.
Okay, and hold on, let's go back.
I know what you're saying.
Hold on, let's go back to the topic. Do you guys have issues?
No.
At all, sexually? Getting hard, erection, or anything?
Okay, if one of y'all did, do you think it would affect your relationship? No?
I think they're invested too much time together for that to be
You know, the
a
best
problem.
thing for a relationship is communication.
It's what?
Communication.
Communication.
We don't keep secrets from one another.
Okay, let me ask, you walked in late tonight.
Oh,
You walked into, right, it should have been the end of the topic, but instead of going on, it's all good. Do you have any problem?
Where the hell do you see
getting
the
hard?
Lately, no.
Did you say that you have problems before?
I have.
He was watching.
Do you know what causes it?
Different medications, yeah.
Okay, medications.
Medications will cause it, weight gain cause it, my diet cause it, a lot of different factors cause it. But when I eliminated a lot of that shit.
Smoking causes it too. Smoking cigarettes. I'm not saying for a lot of people because there's people that I know that were smokers. Mostly straight friends that I knew that smoked like a chain. They could fuck like crazy. And
Hey, no, and as a matter of fact, okay, when I was, I smoked for 16 years of my life, cigarettes, yes. And I could fuck all fucking night long. And like nothing, but, yeah, okay, so that was no problem. But I quit smoking and that wasn't my original. So I don't know, maybe that had something to do with it. But now, I don't know, they're coming back again, so.
It's retraining that brain with the dopamine thing like I was talking about earlier.
Yeah.
okay.
Yeah, but go on.
We're trying to find something real quick on nicotine and ED. And if we can't find it, then we're going to.
So again,
Cut.
we're gonna go back to like we said earlier. Whatever you have to use to get you hard, so you won't be suffering from ED. Make sure you talk to your doctor about it. If you're using a pump, if you go to Zebras or you go to your adult store and buy the pump, make sure you read the directions and use it correctly.
You know, in GNC, they have stuff,
Right.
but you gotta make sure you talk with your doctor before you take it.
Right, and that's what I'm saying. Talk to your doctor, tell them, especially because we are HIV positive.
Same thing with, well, actually, if let's say you go to the HIMSS site, you actually will be speaking with a doctor there. But make sure you're upfront and truthful about everything that goes on with you.
Because he's been on it. He said
Actually,
earlier.
I've checked it out. I really have. Because I actually thought about ordering some. So get off my back.
So again, just be worried about the blue pill. Make sure you start with half. And if it feels like it's not working, then take the other
You don't
half.
start with half. You have your doctor start you on the lowest dose, which is 3 grams. It goes 3 grams, 5 grams, 20, 25, 50.
Okay. Unless you go to Mexico, there's 100 grams over there. One of my clients brought.
Is the blue pill considered a controlled substance?
No.
No, I don't think so.
No,
I
you
mean,
just have to have a
you have to
prescription, though.
you have to have a
You still
prescription, but I don't think
prescription for it,
I don't
though.
think it's controlled.
I mean, you're not going to get in trouble if you go buy from somebody. Like, if you go to Jay and say, yo, can I buy one of your blue pills? He could sell it to you for, like, whatever. If he's smart, he's going to sell it to you for $25, which actually only cost him $7. But because it has insurance, it probably only cost him 50 cents.
Insurance doesn't cover
Actually, probably.
I was a joke, guys.
Actually, my insurance does.
Does it? I don't
It might, because if it has to do with his mentality and everything, it might cover your blue pill.
My mentality.
Well, his age.
My
But
age. Oh,
again, okay, Mark's trying to tell us to cut off because
Yeah.
I think he's getting warned or
I
something
think
like
there are
that.
some announcements we want to make. Cause yeah, it is. It's 8:30. We're getting close to that. If
But
it's not-
again, talk to your doctor about any meds and everything. And whatever you do, just be careful. Don't use gerbils. Talk to your lover before anything happens and tell him, look, this is what's going on. Don't let it be later on because it could affect your relationship.
Yeah.
So
All right. Next week, hopefully, we'll either have somebody from Kind Clinic here. We're going to try to get hold of them within the next couple of days to confirm that. If not them, maybe we can get somebody from the VA, because I know you've spoken to them, have you not?
Yeah, I talked to them, and she
Okay.
said when she lost weight.
When she lost weight? Well, we're going to put her up here anyway.
I'm not rushing her.
Do want to say that this last Saturday we had the yard sale, and we did pretty darn good.
We did pretty well. It was a good turnout. I do want to make an announcement, actually a couple announcements. On April the 10th, correct?
April 10th.
We have a drag show here at Woodlawn Point. Tickets, you can buy your tickets online. The three gentlemen that you're seeing in front of you, also including John, Leo, and Josh, will be performing also in the drag show, but they're not going to be in drag. But come and see them. They'll be the village people. It's going to be really exciting and fun. I will be performing with my partner, Gilbert. Also,
Will you be in drag?
no, we will not be in drag.
You will be who?
But guys, if you guys should come, that'll be great to support Woodlawn Point. And we will have a raffle also that will support Living Positive San Antonio. And
4 items, right?
Yes, 4 items. And the tips that we do make also go to Living Positive San Antonio. Also, it's great entertainment. We have performing Christy Waters, of course, and Dencha will be also performing. She hasn't performed in a while. She'll be performing
Valentino
at
too,
one
right?
point. And like I said, tickets are on sale right now. You can
They're
find them
$10?
on my Facebook or Woodlawn Point, or I think it's also in the Boston San Antonio. Or we can say tickets.
They're $10, right? The tickets?
Yeah, $10 a ticket. Also, you can
Will there
find.
be liquor?
Huh?
Will there be liquor?
I believe, I want to say yes.
Wine and beer, right?
They'll be selling alcohol. I want to say yes on that. They're usually not quote me. But at the moment, it's a yes. Also, we have the quilt. I'm going to have Leo explain the quilt.
You. Speak.
Just
Go
We
ahead.
have a quilt that we're gonna do December 1st, so everybody buy a panel that we're gonna sell for $15.
We're going to have 56 blocks to sell. They're going to be $15 a piece. Buy one in memory of somebody you know. You can buy one, you can buy two. I believe we've already sold 12, or 12 that are spoken for.
So what we're doing is those blocks are going to go on a panel. The panel will be sent to the Names Project and will become a permanent part of the Names Project, a memorial project quilt. Once it goes to them, they will get a story about it that we will send to them. They will put it on their website along with 48,000 other panels, and you can track the panel. It will stay in Texas for the first 3 months. Then it goes to the people that put together the archives and things like that. And then after that, you can actually go in and look up names, individual names. They will have all that on this Names Project, and you can pull it up and virtually look up your person's name that you put on there.
we will have
And these
information.
blocks will be a 6 by 9.
We will have that information up hopefully by next week, where you could actually purchase the squares. I'm waiting on Jase to
Get the
get
block put
everything
together.
going. Yes.
One other thing I want to add though, we are not limited to 56 blocks.
Yeah.
So just,
Yeah, I mean,
as many blocks as you want, we can
so
make
if
that
we have to do
many.
a second panel, we can.
We can do
Yeah.
as many panels as possible.
So,
You know.
I was going to say that, but I forgot what it was. Never mind.
So, look, we're not begging, but we are asking for donations.
Yeah.
Like, we just had this
We have our GoFundMe.
garage sale last weekend. We didn't sell that much because we didn't have that much. So there's
Actually, we did
something,
pretty
if
good.
you know, it is spring. It is spring. So if you're doing your spring cleaning and you want to get rid of stuff, and if it's something that you don't want but you know can sell, call Mark up and say, hey, look, I got other stuff. Can you, Santiago, or Leo, or Wayne come pick this up? I have maybe an old TV, or maybe a
Also-
radio, or something. that would be safe because all the donations that you sell, that you give us, we end up selling it, and that money goes back into Living Positive, to just to do whatever that needs to be done by Living Positive. You know, we do have a Cash App, we do have a GoFundMe.
For the
We can still
quilt.
take that into as well. You know, or if you just want to come in and say, here's $5, yo, we'll take the $5, we'll take $1, whatever you want to. You know, but whatever you can, help us out. You know, it doesn't matter from Hawaii to California, San
To
Antonio,
Georgia.
to if you're in jail, yeah, you can PayPal
I
somehow.
mean, yeah.
If you guys want to donate, like Santiago said, there's ways you can do it. We have a Cash App,
Which is $, Living Positive SA, correct? On the Cash App?
LPSA.
LPSA, okay.
Yes. I'll post that again tonight. If you want to write us a check, make it out to Living Positive San Antonio. You can send it to here to Woodland Point, or give one of us a call, and we'll be happy to pick it up. Any way you want to donate anything, everything is welcome. No matter
Yeah.
what.
Everything's
No, no,
appreciated.
Yes.
Not only are we accepting cash, I mean, we'll accept items for future yard sales, but we also are going to be starting a clothes closet. So if you have old clothes or even generally used clothes, we'll take those as well.
The lady in the back, do you have a question?
I do, because I had a couple of people ask, and I was curious, so when you say the money goes to Living Positive, what do you then do with that money?
So before you started coming, what we used to do before COVID, actually, we used to feed. We have over 140 members, so we used to feed on a Tuesday between 30 to 45 people a night. So we would either buy the food or Mark would cook the food and just feed everybody, and then from there we would play bingo.
Yeah.
So sometimes some of that money would go to bingo prizes.
Bingo
The bingo
prize,
prize could be a soda, a Cracker Jack box,
Gift card.
a gift card, you know, $1, $5, whatever the case would be. It wouldn't be something so crazy, but it would be something that they would enjoy. You know, when you play bingo, you get all excited, like, yo, I want that. You know, maybe if it was a bottle of tequila or something, because we used to do that, we stopped that. But it could be anything that would excite a person. Even if it's soda, yo, you can just see how people reacted just to get a bag and a soda and some chips. You know, it was like, they were like little kids. So something like that would make that our clients smile, that made us smile. You know, something so small was something so big to them.
Okay, so you have clients besides like you all.
Yes.
right?
Yes.
Right, we, again,
Clients underneath.
Yes.
again, we have over close to 150, more or less.
You know, my first time here was, I remember dinner.
Yeah.
Right.
I don't remember being
Yes, the bingo we played at the last
Yeah.
hour.
Yeah, it was 2 hours from 7 to 8 was, we did things like this. Okay, no, shut up.
The first hour, we would meet everybody and we would have a speaker. And we would talk about certain topics related to HIV/AIDS or other topics that people wanted to hear about. And the last hour, we would play bingo. Everything that we raise, it goes back to the group. None of us get paid here. None of us take the money. Everything that we raise is in the book. We have receipts for, if we spend something like we spend the money on buying the clothes, stuff like that, we have receipts for everything.
Oh, I'm not saying
No,
it's
no, no.
shady.
Oh, no, we're just saying. No.
I'm just saying. We have records for everything that we get.
Yeah.
And we can prove to anybody this is where the money is going to. We had yesterday, this is an organization here at Woodland Point,
Yeah.
who gave us $200 in gift cards for HEB. For next time we start bringing people in, that's the way they help us to start buying food. Like the sodas, chips, and all that, that comes out of my pocket. That doesn't come out of the money.
Yeah.
That comes out of my pocket. I'm not the only one who buys stuff. Leo does. Santiago does. Sometimes Wade.
I did too, don't even go.
You don't take your food stamps.
Yeah.
But anyway.
He does buy sodas.
So it's like food agree.
Right.
Yeah.
I mean, let's say you decide to bring something. Okay, you decide to bring whatever. You could give him the receipt, you know, and you know we're all enjoying whatever you bring, a cake, cookies, whatever, you know, and that'll go towards the thing. But you know, it's not for you to get reimbursed. I mean, if you want to get reimbursed, that's on you. But if you're bringing it out of your kind heart, say, look, I'm donating all these cookies for all of y'all because you decided to wake up at 4 o'clock in the morning and bake us cookies because you look like a baker, and I'm cool with that. You know, I like cookies. You know, I am fat. So, well, most of us are fat. But, you know, John wants to bring us, you know, more cookies or cake, whatever. You know, that's cool. But, you know, some stuff like that, especially once we do come back all together again, we all bring food. You know, sometimes either one person bring food or we all decide, you know, he might bring a cake, I might bring some dip, he might bring, well, himself, Leo might bring something. So we all help out. We do this not because we want something out of it, but because we want to help out. Because some of the individuals that we have, they might eat once or twice a day.
That's what I was just asking.
You know,
Okay, that's what I was just
a lot of our clients are homeless.
Okay.
So that's where I'm going with. We have close to 150. Off and on, they come and they go. You know, because sometimes it is really hard for them to come all the way from here, from downtown. Because there's only one bus that comes down here, but they still have to do like a 4-block walk or something.
Yeah.
So, but
Depending
we try to help them
on
out.
there is
There's
another
a
bus that actually
comes
comes
outside.
by.
It's just very limited.
It just comes once an hour.
So I'm just curious, so do you sometimes, like, if people come to Oregon, do you sometimes give them, like, bus passes and stuff like that nature, or no?
There's
No.
agencies that do give us.
Okay.
Yeah, there's agencies, whoever their major agency is, if they go through Beat, ARC, SAFE, or FACTS, they'll get a bus pass from them. So it'd be kind of like double dipping if we gave them a bus pass. It's like, but for us to give them a free meal, a warm home cooked meal, that's everything to them. They love us. You know, and at the end, if we still have a lot of food left over, yo, take it. And some will take place home.
And then my client is that, you know, I know that have come up to me personally, and tell me they're hungry. They don't have no food at home.
Yeah.
These guys will tell you, I got many food at home. I always have. And so we get food. I'm the person who will open my kitchen and say, take whatever you want. Because I'm the kind of person who wants to help out. And to me, by helping them out, I don't want my name to be put out there and say, Mark gave me this. No. To me, it's, you need the help, I'm here for that. I'm helping you out. And that's what we all do here. But that's where the money goes. It just stays in the positive.
Yeah.
It does not leave you in the positive.
So it's kind of like having a fun night for some people that don't normally have that. They can,
Yeah.
you can all eat together, you can play games together,
Right.
you can.
I mean, I don't know if you've seen some of our old videos or even some like the old pictures that we posted on Facebook. You know, we care about our
Not
clients.
to cut you off, but I think it's time to say goodnight to our Facebook Live audience.
Oh,
We will continue this discussion after. Want to thank everybody for showing up. Is there any other announcements we need to make before we say goodnight? Good night, everybody, and we'll see you next week on March
Bye.
30th.
Love y'all.